Good afternoon. This is Marcos Breton, columnist with the Sacramento Bee, and welcome to the latest edition of Facebook Live with Sacramento Mayor Darrell Steinberg. Mayor, how are you?
Good. I'm doing fine, Marcos. Good to be with you.
Good to be with you too. So let's get right to it, Mayor. It's a big week in Sacramento. We are moving into a different phase of our battle with COVID-19. Malls are going to be opening. Restaurants will be having dine-in service, and I guess I would ask you is, are we ready for that?
I think we are ready, although, as I've been saying, we can never let our guard down, but we are ready. Look at the governor laid out some very clear revised criteria earlier in the week, and we meet the revised criteria. I think it's important that people know what they are. Governor said you can't have more than a 5% average increase in hospitalizations over the past 7 days, and no more than 20 hospitalizations in the last 2 weeks. Well, in Sacramento, on the 11th of May, we had 16 people in the hospital, 9 in the ICU. As of yesterday, 11 people in the hospital and only 4 in the ICU. And of course, we hope for the best for all of those people, but that's a downward trend. He said that you have to have fewer than 25,000 new cases, 25 new cases per 100,000 residents over the past 14 days. We've only had 75 cases. We could have as many as 400 and we would still qualify. So we're well below that threshold. We have to be up to 1,550 tests per day. The county has been ramping up the testing pretty rapidly, and by the time we open, we will have that amount of testing, including with the opening of 3 new community clinics. So objectively, we meet the criteria. We have been consistent in being able to flatten the curve. And, this is not a question of if, it's not even a question of when, because as of Friday we'll open, but it's always a question of how. The how is so important because as we talked about last week, we have to open in ways that not only follow the letter of the protocols in terms of physical distancing, for example, in our restaurants, in our malls, in our retail, but the spirit, right? People should be wearing masks. People should be conscious of being that 6 feet apart. None of this is perfect. We're going to elbow and run into each other. I get that. But the more vigilant we are, the more confident I will be, and we will all be, that we can then move forward instead of having a spike and having to move backwards. But this is the right move. We can't continue with this forever, and it's risk reward. And too many working people hurting, too many small businesses. It's time to try it.
So you and I were downtown or in Midtown this morning, and we saw a really nice person who walked by and said hello to you. And that person was not wearing a mask. And so I wonder, so when restaurants open, and look, I love our restaurants in Sacramento too, and I've really missed them in the last 2 months, but what's it going to look like? So if someone walks into a restaurant to eat, they have to be wearing a mask, right? Or they won't be served? Is it that explicit?
Well, I don't know yet. The county is still developing the order, but certainly the host or hostesses, the wait staff, the people cooking the food, undoubtedly they're going to have to wear masks. Now, that's not yet a county order, but I know the restaurants in talking about what they want to do to ensure that they can continue to stay open and keep people safe are going to impose those reasonable mask requirements. Obviously, for the customer, you can't wear a mask when you're eating. So I'm not sure exactly how that will lay out and look. Maybe you wear a mask when you enter, but when you get served your meal, obviously you take it off. But I think it is important that there be a uniform county policy because I don't want restaurants to be in a position where they're angering their customers in asking them to do things that, some would say, well, this isn't required. Well, let's have some common sense rules. You have to wear a mask every minute of the day or in every setting. But when you're out in public, in a setting where you're among a lot of other people, why not take the precaution? I think it should be a county-wide requirement.
So we're going to find out from the county how explicit their I guess recommendations are, or their policy is. But there are people in our midst who, if not calling it a hoax, believe that this is an exaggeration. And so I'm wondering if when restaurants are open and there is a guest who just flat out won't wear a mask, what happens then?
I think then they can't be served. I mean, I think that it is appropriate to enforce some basic standards and basic rules. I mean, restaurants have rules that say, some restaurants, that you have to wear a shirt and shoes. Is that unreasonable? In the midst of a continuing public health crisis, it is not unreasonable to ask customers to take reasonable precautions. And by the way, the real issue here with the opening may not be a lot of these rules necessarily. The real issue may be whether or not consumers and customers feel confident enough to want to go out and go back. I know I'm going to, because I want to support our local business community. But one thing that would give consumers a lot more confidence would be to know that there are a uniform set of reasonable rules that protect them and protect others. And so, yes, there are going to be people who philosophically disagree. They have a choice. They can not go to a restaurant for now. And by the way, none of these rules are intended to be forever. We're obviously moving through stages of this pandemic. But look if you think it's a hoax, and I don't think many people do. First of all, the vast majority of the California public, overwhelmingly, look at the public opinion polls, they support the continuation of reasonable stay-at-home orders. You look at what's happening in other parts of the country and other parts of the world. We have been so lucky here, but people in other states and, of course, in other countries, it has been a disaster with untold amount of death and illness and human suffering. And so we can just see what that's about. And now we're not saying, okay, we see that, and therefore we're going to keep things closed forever. No, the order is just the opposite. And I think we should be enthusiastic about it, returning people to work and returning small businesses to be able to survive and to regain our momentum that we've had in this city to open up. It's the right thing. But again, it's how we do it, not just for the health of people who partake, but for all of us. And again, I'm almost repeating myself too much here, but there will be an inevitable, people talk about an inevitable second surge here. Will that surge be large, or will it be modest as we have experienced here in Sacramento? If it's modest, we get to continue moving forward. If it's large because we didn't take the right precautions, or unrelated to the opening, people just get loose and start gathering in large numbers and violating the rules in a flagrant way, and there's a huge spike, we're then going to have to shut down again. So the choices are pretty clear. We can only control what we can control, and what we can control can make a difference.
There was an awful lot of pressure brought to bear, protests, and obviously a lot of internal discussions. I know, we both know some wonderful people in our community who own businesses and have really been hurting. And then what, Elon Musk of Tesla got a lot of publicity by basically defying the governor's orders. And I guess from your perspective, did that pressure and did some of that defiance maybe push us further along in reopening than we might otherwise be?
I know the governor well, and obviously I know myself. I know some of the other officials that have been out front on this, and that was not the pressure that I think moved us forward in revising these stay-at-home orders. But as I've said before, there was a very different kind of a pressure because people are hurting economically. That is real. And by the way, there are public health consequences to people not being able to work, to massive unemployment, to people not being able to pay their rent. I mean, we talked about mental health last week. That's just one example. And so that was the pressure. And that's where the balance, I think, becomes much more of a real one for me, I think for the governor as well. He said many weeks ago, and I agree, that while the more restrictive stay-at-home order was necessary, that it could not, by definition, last forever because we cannot wait for a vaccine. That's just not realistic because the pain on the other side, on the economic side, is already too profound. When they start making comparisons to the Great Depression, and I look at the unemployment rate today versus during the Great Recession when I was leading the Senate, and that seemed like the worst economic period in modern history. I mean, this is serious, and we have to attend to it. So that's the pressure. And so obviously the orders now loosen up in response to that pressure, appropriately so. But it's, as I said last week, it's a controlled experiment because we don't have national testing to scale, and we cannot aggregate people based upon their testing status, either on the diagnostic side or on the antibody side. That what we are doing is in fact a controlled experiment. It's a necessary one, but we're going to have to do it right. And then we're going to have to observe over the course of 2 days, 3 days, 5 days, 10 days, look to see whether or not there's a spike. If there is, to what degree. And then, as the governor says, toggle, if you will, until we can gain some momentum to move forward even more quickly. I just think this is a matter of good judgment, science, data, but also some common sense and recognizing that none of this is perfect. We don't have all the answers, but the pressure on the economic side, because of people losing their homes, losing their businesses, not being able to pay their rent, and the desperation, that is very real and must be accounted for.
So, Mayor, let's reset some of the numbers so people are clear about them in their minds. So, please repeat first where we are in terms of hospitalizations and ICUs, and then where we are in the number of tests that we're currently performing in Sacramento County.
Okay. So, again, the governor laid out some criteria and said if you meet these criteria, you can move deeper into stage 2, which is where we're at now. Right. Which is to be able to open restaurants, to be able to open.
And we are the largest county moving into this phase of stage 2 in California.
We are. And so what the governor said, if you've had a modest increase in the number of hospitalizations over the past 7 days, percentage-wise, he said 5% over the last 7 days, or using a whole number, if you've had no more than 20 hospitalizations in the last 14 days, you check that box. Well, our hospitalization rate has not gone up 5% or less. It's gone down between May the 11th and the 19th. And the number of additional hospitalizations we've had have been fewer than 14. So we meet that criteria. Then they said, okay, with increased testing, and we are increasing our testing, we want you to evaluate the number of positive cases that you have revealed as a result of the testing. He said less than 25 new cases per 100,000 residents over the last 14 days. We've had 75 cases over the last 14 days. When you do that math, we could have up to about 400 or a little over 400 and still meet the criteria. So we are well below. Then on the testing side, when you look at the governor's equation, we need to be testing 1,550 people a day. The county yesterday attested to the fact that we have that testing capacity. Now, some of that I think is rolling out in real time, but we have in fact increased our testing significantly, like a lot of other parts of the state. So on those 3 main criteria, we check the box. Now, if you remember a week ago, the criteria included a very difficult check, which is you couldn't have had a single death over the prior 14 days.
Right.
Even though our death rate, again, is low, one death too many, even though it is low, we couldn't meet that. Neither could 95% of the California counties. He removed that. Why did he remove it? In part because of this balance we talked about earlier and this very real economic pressure, but in part, the experience of the smaller counties who were able to meet that criteria a week or 10 days earlier, they did not experience some great spike in the number of hospitalizations and deaths. So again, this is a controlled experiment, and it's a necessary one. And of course, he has not given the permission for anyone in the state to open nail and hair salons because of the necessary close physical proximity between the person providing the care and the service and the customer. That will come, but it will only come if we can continue to meet these kinds of criteria as we open up further.
When I saw initially the no deaths in 14 days, my first thought was, we're never going to reach that. I mean, our county is so big, and so it was interesting politically when that one went away, because it seemed like in real time there was a recognition that the majority of the state would never be able to reach that threshold.
I think that's absolutely correct, but I also think that regardless of how exactly it was communicated 10 or so days ago, what they were really saying was, let's test out the deeper part of phase 2, restaurants, for example, in smaller counties, and let's see what happens. And if it's okay, then we will move on to the larger counties, and that's now what is happening.
So to what do you attribute Sacramento being able to reach this threshold when other large counties have not? What have we done that obviously we're speculating, right? It's hard to know, but what happened? What went right in Sacramento County that has kept our numbers? Because when you read the numbers, they're and again, not to be insensitive, one death is too many. One person in the ICU is too many, and so it's not. This question is not designed to be disrespectful to the pain and suffering that people here are experiencing, but that we haven't seen. We were girding ourselves for this big wave that at least now hasn't come, and I wonder if in your conversations with Dr. Peter Bielenson, if there's an understanding as to why that big wave so far has not come in Sacramento.
Well, we don't know exactly, but there are a few things we may be able to point to. One is Sacramento may be a little less dense than many parts of Southern California and even many of the Bay Area counties. We're a little bit more spread out. And as a result, not in as close proximity with one another, thereby making the spread of the disease a little tougher. I think we've had a unified leadership, and that's also been the case in other parts of the state. So we're not unique there, but I think we've been all consistent from a county side, from a city side, from a civic side, to say this is what we all know we have to do. And in the business community and the nonprofit community, I mean, the messages our modes of communicating within our community are pretty vast and pretty deep. And I think the word has really gotten out there that this is what we expect of our community. And I also think there's just plain good fortune sometimes involved here. Your newspaper, the media, I think, has done a very good job too, calling it out when there have been, big congregations of people. It's happened in a couple of isolated instances, and I think it's shut that kind of thing down pretty quickly. And so, but I don't have any illusions that it couldn't change. I think there is that tendency and that risk to just sort of get too relaxed about this. And, in some ways, you can't have it all, but in some ways, we do have the opportunity to have, if not all, most of it. We can reopen the thing that we've all been struggling with in so many ways. We can reopen, and we can maintain a low rate of infections and hospitalizations and death. But it only will be if we take what is within our control and we continue to act in ways that are responsible to each other.
So people, when they go to restaurants, they should wear masks. Obviously, they can't wear them while they're eating. And they cannot go in a party that's larger than 10, correct?
That's correct.
A restaurant cannot accommodate a party that's larger than 10.
I think that's exactly right.
What would you say?
I'm sorry.
Yeah, I'm sorry, Mayor. What would you say to those who have some trepidation about going out to eat at one of our fine restaurants? Could you like look one of our citizens in the eye and tell them that, yeah, it's safe to go back?
I think I would be honest, and I would say, if you're having some trepidation, I understand that. I have a little trepidation too, but I'm going to take that step because I believe that with the right kind of safety protocols, that we can begin to integrate ourselves back into our communal life. I don't know that I'll go out to eat as many nights as maybe I did before this. I mean, I think I will take it slow, and I think people should take it slow. But I think it's important that we take that step. And if you're not comfortable, then that's okay too. There's no pressure to do what you don't want to do. But I'm going to do it, and I'm going to I'm going to try to promote what it means to ensure the right kind of sanitation, the right kind of distancing, the right kind of safety protocols, so that more people can be confident and comfortable that beginning to go out, small, maybe just with your spouse or with a single family member. Certainly the 10 or fewer people, I would not encourage big dinner parties of any kind. I don't think that would be the right thing to do at this point, maybe weeks from now, but start slow, take that step, and before you know it, we'll ratchet it up in a way as we test more, as the rates continue to stay flat, hopefully, and we gain more confidence.
So people should be signing up to go get their test at Cal Expo, correct? I mean, you got your test, did you not?
I did. Cal Expo is one side. We now have 3 community clinics. There's the Robertson Community Center in North Sacramento. There's La Familia, of course, Maple Avenue, and there's the St. Paul's Church in Oak Park on 14th Avenue. And so there are a number of options to choose from, in addition to Cal Expo, in addition to your medical provider. There are a lot of ways to get tested. And I got tested, and I wanted to see.
How did you describe the experience?
It was nothing.
Okay.
It was maybe 3 seconds of a little tickle up the nose, and then it was over like that. And so it was no pain, did not hurt. I didn't even sneeze with the pickle. It was all good.
Have you gotten your results back yet?
I have not gotten the results back yet.
Okay.
I'm not worried about it.
Yeah. I'm thinking I need to get my test as well. So we're getting close to 1,150 tests per day in Sacramento.
1,550 tests. I think the county is aiming to get to 2,000 tests a day. They're working very closely with the University of California, Davis, to ensure that they can procure all of the swabs and the other pieces of the testing. And they are getting to a number above 1,550. They're going to meet that threshold.
Great. Well, Mayor, I've enjoyed this time very much. It's always great to talk to you. I think people appreciate the information, and I'm going to endeavor to eat at one of our fine restaurants in the coming days, and I'm looking forward. I'm a little nervous about it, but I'm looking forward to getting back out in the world again. Nervous is okay, and everyone can kind of do it at their own pace. I think that's okay. We'll stick together and support you whatever you choose, as long as people are not doing things that just are flagrantly in violation in a way that makes it harder to keep going forward. We'll be okay. Well, it's a holiday weekend coming up, and if there's warm weather, there's always the concern of people congregating in big groups at the river and whatnot. Real quick before we go, if something like that happens, how will officials respond to it? Well, I mean, I think the officials have done, our police and sheriffs have done a very, very good job. They're not arresting people, but they are warning people and asking them to please, if you're congregating in large groups, please break it up here or distance yourself. And I think that's the way it will continue. Just asking people really to be courteous and to be thoughtful and to use, common sense always goes a long way, and you can still have a good time. You can still enjoy the warm weather, but you don't have to congregate in large crowds and get near each other. And again, I think the mask thing is maybe a little inconvenient, but why don't we celebrate? Why don't we celebrate how awkward it's going to be to wear masks all over the place? Why don't we just kind of admit it? Yeah, it's a little awkward. There it is. You got your Sacramento. I have my Sacramento Bee mask here with Scoopy the Bee on it, and I wear this when I go out. It was made for me by my colleague Mickey and Koji, and I never pictured myself wearing a mask, but there I was out among people in Sacramento. We should not congregate in groups larger than 10. We should not have cookouts of people larger than, because this is a big barbecue weekend. It's a big sweat weekend. We should 10 is the threshold in any size group of people larger than 10. That should not be happening this weekend, correct? And even among 10, you should maintain that physical distance. Yes, and so. Let's embrace the unconventional here. Let's embrace that which seems out of the ordinary for us. And the more we do that, the faster we will be out of that phase. Masks and all this stuff is not a permanent part of life. It's just ensuring that we can get closer to where we all want to be faster. And this weekend's kind of a test. I hope that people have a good time, but just do it in a cool way. So to all our friends and fellow Sacramentans, please keep it to 10 people or fewer. Maintain social distancing. Wear your masks, please. When you go out, and let's remember this is a moment in time, and that we'll get beyond this. And if we keep our numbers low, then we can feel good later on, and that we're able to take care of each other. So Mark, that's a great message to put out.
And not
so much
to overstate the point here.
I want to thank Mayor Darrell Steinberg for his time, as always. Yes, sir.
Thank you. Thank you, Marcos.
Go right ahead.